Hi, my name is Melissa and I'm a respiratory physiologist. If your doctor has referred you for some breathing tests, this short video will explain exactly what to expect at your appointment. Your GP may have referred you because you have experienced symptoms such as breathlessness, wheeze, or persistent cough. Lung function tests help us understand how well your lungs are working. When you arrive, I'll explain the tests fully and answer any questions you may have. I'll ask you a few simple questions about your symptoms and medical history. I'll take a height and weight measurement. I'll measure your oxygen and your heart rate, and then I'll explain the tests before you have a go. There's no need to feel nervous. I'll guide you through every step of the way. If your GP suspects asthma, we will start by doing a pheno test. Pheno testing measures if there's any airway inflammation in your lungs. The test starts by taking a big deep breath in through a mouthpiece and blowing out steadily for around 8 seconds. You have a cartoon on the screen to guide you. At the end of the test, it takes around 1 minute for the machine to provide us with a result. Your GP will also ask for spirometry. Spirometry testing involves taking a big deep breath in through another mouthpiece. You'll have some nose pegs on your nose, and then you'll blow out fast and hard for as long as you can to empty your lungs. This tells us about the speed at which you can blow air out at, but also the volume of air that your lungs hold. Another test we do is reversibility. Reversibility testing requires you to do baseline spirometry testing, then inhale salbutamol, which is a blue inhaler, and then repeat the test. This gives us an idea of how well your lungs respond to inhaled medication. The final test we would do is an advanced lung function test called transfer factor. Transfer factor testing measures the efficiency of your lungs in transferring oxygen, which is the main job of our lungs. You will start by putting the mouthpiece in your mouth and breathing normally. I'll then ask you to blow all the air out of your lungs, nice and steady, before inhaling fully. When you inhale fully, I'll ask you to hold your breath for 8 to 10 seconds before blowing back into the tube again to record the result. At the end of your test, I will write a report and send it back to your own GP. Your GP will discuss this report with you in detail and discuss next steps.